Here we're going to discuss about other uh, aberrations, coma, oblique astigmatism, curvature of image, and distortion. So let's start. So coma, as spherical aberration is on-axis aberration, coma is off-axis aberration, which means the object or light not coming from the axis. Its object is always in a different direction, that is off-axis, not in an optical axis. Okay, it affects sharpness of the image, not the position of the image. And spherical aberration also affects the sharpness of the image. Image of a point object resembles the comet or teardrop or ice cream cone. That's why it terms as a coma. So image is not symmetrical with respect to the optical axis. Is it? Definitely not. Can you see if optical axis goes there, this larger portion, greater size portion is upward and the low small size portion is lower. So that's why it's important. It's not symmetrical with the chief ray or optical axis. The problem is largely due to the large aperture optical system. That's why people controls it. If aperture uh, size is smaller, then entrance pupil is smaller, or entrance pupil and exit pupil are smaller, then the problem of coma reduces. The same thing applies for spherical aberration too, isn't it? They both are mainly large aperture optical system problem. If the aperture is smaller, then the chances of coma is getting so less. Okay, and the same thing you will going to hear in case of Jernicke polynomials too. Okay, so let's move. This is just a picture of comet. So this is coma. So coma is often called the worst of the all aberration, exactly because both the intensity, asymmetrical blur it causes, and absence of point. There will be no point. There will be always asymmetrical blur, and that could usually consider as a point of least confusion. So uh, since it's asymmetrical and there is no particular point, it's like comet, a cone. That's why it's called worse of aberration. An optical system with a strong coma is likely to present with an unacceptable image at the center of the optical field, but the image progressively more blur. So its center is more clear in this picture, and periphery are more blurred. So this is how this type of aberration is seen in case of coma. So coma depends on lens size, definitely, shape form, definitely. Incident beam should be tilted, not straight. So aperture stop in position. Incident, if aperture stop is smaller and position within the beam optical system, it will create less coma. Incident beam configuration, refractive index. Coma, like spherical, will depend on the lens or aperture diameter. Is proportional to always square, isn't it? So if aperture size increases from 2 to 4, then coma increases in square, that is 4 times. If 2 times the aperture size increases, coma increases by 4 times. It's central important. Just understand these things, how much important in case of aberration to describe with relation to aperture size. If a lens or optical system that is corrected for coma aberration is called isoplantic. Sometimes you heard this term isoplantic. Just remember, it's if lens or optical system is corrected for coma, then we call isoplantic. And in condition spherical aberration is corrected, the lens optical system is called aplantic. So just remember, if correct coma, then it's called isoplantic. And if we corrected coma and spherical aberration, this type of lens called aplantic. Sometimes you heard this term, just better to remember. Okay, so positive coma and negative comas, you know this term, positive and negative, positive spherical aberration and negative spherical aberration. So that's coma if the point of the coma, when the tip of the comet is pointed towards the optical axis. In this figure, it's pointed towards the optical axis, isn't it? So it's positive coma. If it is pointed towards the away from the optical axis, it's negative coma. Okay, this is negative coma and this is positive coma. So on axis coma, it's possible. Definitely it is possible. On axis coma also occurs on axis object. So definitely we are describing coma as off axis object, off axis aberration, but in on axis object it is possible that coma happens. How it is possible? See, if optical components are not centered or tilted with each other. Basically, our eye is like that, isn't it? This is our retina, this front surface cornea, back surface cornea, lens, and back surface to lens. All the four structures are not aligned at all. And if we do refractive surgery in the front surface and we change the optical center of the front surface of cornea, then the on-axis coma, probability of on-axis coma is higher. So it's it is the case. We can make that case that on-axis coma is possible. So now come to the next topic, which is oblique astigmatism. This is the really important astigmatism. Important astigmatism, not astigmatism, is important aberration when you are going to talk about the lens design. Because the majority of lens design, we can think in terms of oblique astigmatism, because spherical aberration and coma both can be corrected by the pupil size, but oblique astigmatism not at all. So oblique astigmatism we sometimes call as marginal astigmatism or radial astigmatism aberration. It is also of axis aberration like coma. When a small bundle of light strikes on the spherical surface, just remember that spherical surface, where it is striking spherical surface of a lens from an angle. What do you mean by angle? It means of axis. Okay, so oblique astigmatism causes in that if lens is spherical but hits in a slanted way, it creates oblique astigmatism. The light focuses in the two image lines known as tangential and sagittal image instead of single point. What it should be, if it is spherical lens, it should be point image. But if it strikes slantedly, obliquely, then there is formation of 2 point image, which means one tangential, one sagittal, and that 2 point image means basically, isn't it astigmatism? So that's a simple thing. It affects both sharpness of the image and position of the image. This is the first time we can see the sharpness and the position of the image. Both spherical aberration and coma only affect sharpness of the image, but oblique astigmatism affects both properties, that is sharpness of the image and the position of the image. And it's very important. Just remember this point. Oblique astigmatism presents even in the absence of spherical aberration and the coma. Just remember this. Oblique astigmatism presence even in the absence of spherical aberration and coma. Okay, so this is how we understand this concept. Its oblique object is present obliquely, and this plane, two plane, one sagittal and another tangential plane, has a different focus. Even though the lens itself, this lens itself, is spherical lens. If it is toric lens, definitely there would be two focal point, but it's a spherical lens because the object light passes from tangentially, light passes obliquely, and that creates two focus here. That's why it's called oblique astigmatism, because light has to pass through oblique, not straight. So there is two type of focus here. One is tangential focus. This is tangential focus. One is sagittal focus. This is sagittal focus. Tangential focus is always more powerful. Tangential. Sagittal is always less powerful, and sometimes we call it cop and sausage shape. So this is a picture from Brian Holland Institute. So in case of sagittal and vertical features, just pause the video and see if what you can see here. It's blurry, isn't it? Out of focus. And clinical correlation, even when oblique astigmatism is minimized through the proper selection of front surface power, it can still be problematic when the lens is tilted with respect to the eye. It's very important to understand. It's not just you hit the surface straight. It's not just light comes from oblique. It's when light comes straight, but your spectacle is obliquely placed, isn't it? When it tilts. So when that matters, don't you think it's called um, what do you call horizontal angle wrap, pantoscopic tilt? These are all the things that takes place. Okay, let's common example of warp glass dihedral angle, isn't it? And another is definitely pantoscopic tilt. So this is one of the formula you can you can just compare how this oblique astigmatism plays the role. So this second formula is most important, because this formula gives you the idea. If we tilt the lens from theta degree, if power is spherical f, then how much cylinder is induced? And that induced cylinder is definitely going to be an oblique astigmatism. You can see if you have digital lensometer in your setup and in your practical room, then you can tilt the lens, then you can see the induced astigmatism rapidly, which is very easy practical that I used to do with my students. So so let's take an example. This is the diagonal angle, isn't it? This is face wrap. It should be like this, but it is tilted by theta angle, isn't it? So in this questions also, it is written that if 20 degree of 6 diameter sphere is tilted, then see 0.8 diameter of cylinder is induced. It's simple. So clinical correlation is that when 6 diameter of my spherical tilted by 20 degree, definitely sphere increases a little bit, but cylinder, yes, it increases a lot of amount. Okay. So pantoscopic tilt is same thing. When 8 degree 8 diameter tilted 15 degree, then definitely this happen in this cylinder. So sphere also increases, cylinder increases, and the axis depend upon how the axis of tilt, isn't it? So pantoscopic tilt also increases. See, face wrap or face palm tilt or pantoscopic tilt, whatever it is. If you're tilting the lens, it will create oblique astigmatism. So another aberration is curvature of image, and in case of curvature of image and distortion, these two falls on the not into the point image but into the wide area images. That is, it needs, if curvature of image is to be taken in account, then we have to take in account with the field aberration, not in a point aberration. So it must be in a wide field. Assume the paraxial optics and plane object image. See, if the versions of this is smaller, that's why it focuses nearer, isn't it? The versions of this is larger, it focuses away from it, isn't it? That kind of equation you can understand from the versions equation. See, the distance from this point to this point is larger, that's why object versions is smaller. That's why image versions is larger, that's why distance between this and this is smaller, isn't it? Can't you think in this way? If object versions is smaller, image versions would be larger. If object versions is larger, image versions would be smaller in case of plus lens, definitely. So that's why image versions is equal to object versions plus power, isn't it? L plus power. So in this case, visible surface is free from astigmatism, principally problematic for optical instrument because our eye retina is curved. If so, basically, uh, what do you mean by curvature of image is, let's talk it clearly. The absence of other aberration, plane object forms the curved image, which is known as curvature of image. This is the plane object, but the image formed by the plane object is curved in a larger field. That's what curvature of image basically means. So you have to understand this concept, okay? This is because all points are extended from object are not the same distance from the spherical cone. Not from this point, all the point of this object is not same distance. So if distance is greater, then vergence is lesser, and at the same time, image vergence differ. Okay, so that's why that principal surface is free from the astigmatism. Principally problem in optical instrument because in our eye retina is curved. That's why in optical instrument it's a problematic thing. See in this picture, this nose of the dolphin or whatever, it has shorter distance, and that's why it places far, and tail has a far distance and so it places near, isn't it? That's what we I wanted to explain to you. It's the distance matters for the large object, definitely from optical system. So that's why in case of curvature of field, if center is focused, periphery is blurred. If center is defocused, periphery is clear. So this is what I want trying to tell you. So finally, distortion, which is very major problem in case of effect glass, in case of low vision, and all those things, where distortion never ever creates the problem with the sharpness. Yes. Image is sharp, but magnification differs. So magnification of the extended image varies with the distance crosses, and that's why it creates this altered shape image and lateral position, but not image clarity. Image clarity is always clear. Okay, just remember this. Image is always clear. So that's why if plus lens, it will create pincushion p for p. In minus lens, it will create barrel distortion, isn't it? A square shape place in a minus lens, a square shape place in a plus lens. This is plus lens, this is minus lens. Plus lens p for p creates pincushion by plus lens. We note distortion. Symmetrical when formed by the center or coaxial optical system has symmetrical optical axis. Incursion creates symmetrical distortion by plus barrel creates symmetrical distortion by negative lens. A symmetrical distortion definitely caused by non-center optical system, especially by prisms. Prisms create asymmetrical distortion. So this is barrel distortion and this is pincushion distortion P for P. Okay. So asymmetrical distortion created by prisms. So you can sometimes patient even complains. So if you put a large prism like 6, 7 prism in one eye, so you can see in your life such a case. And combination of aberration. Just remember that one aberration never comes with just oblique astigmatism or spherical aberration. There are a lot of aberrations come together, and you have to understand that only one aberration isolation is quite difficult in every real case scenario. So this is the case of coma and astigmatism combined in this small pictures. Just see, close the video and read all these things. Okay, so finally coma of axis oblique astigmatism, which is very important in spectacle prescription and our day-to-day life. When we use pentoscopic tilt, we use all these things. Oblique astigmatism is central important. When we design the spectacle design, oblique astigmatism major important factors. And curvature of image not important in case of eye. Distortion only important when there is high plus and high minus and wide field. Okay, so you have to remember a few things. So this is it. It's important book, very important. Just begin with this. My favorite of all time, Professor Dr. George S. Melis. Bis then, choose.